Okay, so today we're diving into something a little bit delicate. Anal bleeding. I know, maybe not the most appetizing topic, but trust me, this deep dive is important. And, we've got medical journals, some alternative perspectives. I guess my biggest question is, can we make this both informative and, a little less ew?
Well, it's funny because there's such a stigma around this. So many people actually experience this, but there's this reluctance to actually even talk about it, which is kind of ironic because understanding anal bleeding can really be key to your overall health.
Right. It's like our bodies are trying to send us a memo, but we're just like, nope, 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 not
Yeah,
reading it.
exactly.
So let's decode the memo. Causes, treatments, and maybe even some surprising ideas about how our digestive system works.
Yeah. I mean, think about it like this. A cough could be a simple cold or something much more serious. Anal bleeding's the same. It could be super simple, or it could be a sign of something that needs attention.
So we're talking like a spectrum from, oops, ate too much spicy food, to
Yeah.
like, uh-oh, better call the doctor.
Yeah, you got it. Let's start with those oops moments.
Hmm.
Hemorrhoids, these are incredibly common, especially as we age. Basically, they're swollen veins, down there.
Yeah.
And they can cause bright red blood, especially when you're, well, doing your business.
Okay. And speaking of things that maybe sound scarier than they are anal fissures,
Yeah.
those are like tiny tears.
Yeah, like almost a paper cut inside the anus.
Hmm.
And they can be really sharp, especially during bowel movements. You might see bright red blood there, but the pain, that's what really sets it apart.
Ouch. Okay, so those are kind of like the usual suspects, usually manageable. But when do we start worrying?
Well, diverticular disease is one to watch out for. It's when pouches form in your colon and they can bleed. Tricky part is it's often painless. So people may not realize it's happening until it's more serious.
So it's like a silent alarm going off.
Yeah.
That's kind of scary.
Yeah. And then there's the big one that everyone worries about, colorectal cancer. Bleeding can be a symptom, but often it comes with other changes, like your bowel habits are different, unexplained weight loss, or feeling constantly exhausted.
Those are the red flags, waving like crazy. And what about things like inflammatory bowel disease, like Crohn's or ulcerative colitis? Those can cause bleeding too, right?
Yeah, IBD involves chronic inflammation in your digestive tract, and that can lead to bleeding, along with pain in your abdomen and weight loss.
Okay, so we've got our lineup of potential culprits. But before we jump into treatments, I'm curious, is there a common thread here? Why is understanding the cause so crucial for finding the right fix?
Because our bodies are these interconnected systems, and treating just a symptom isn't always enough. You got to understand the root cause to actually find a solution that
It's
works.
like trying to fix a leaky faucet. You can keep mopping up the water, but until you figure out if it's a loose pipe or a broken washer, you're not really solving the problem.
Exactly. Now let's talk about how we actually fix those leaky faucets in the digestive system. And there's a whole toolbox of treatments depending on what's causing the bleeding.
Right, toolbox time. What do we got? Lay it on me.
Well, for hemorrhoids, a lot of treatments focus on reducing the pressure and irritation. So think over-the-counter creams, those warm six baths, getting more fiber in your diet to soften things up.
So basically making things a little more comfy down there. But when those creams just kind of mask the symptoms, when would they not be enough?
You're right to question that. Creams can definitely provide relief, but they don't always get to the root cause. If hemorrhoids are really severe or they keep coming back, there are other options.
Ooh, okay, spill the tea. What else is in the toolbox?
Well, one common procedure is called rubber band ligation. Sounds kind of intense, but it's pretty quick. It's like, imagine a tiny rubber band placed around the base of the hemorrhoid, and that cuts off its blood supply. So it basically shrivels up and falls off.
Like it just falls off. That's kind of wild.
Yeah. And there's sclerotherapy, which is injecting a solution that makes the hemorrhoid shrink up like a raisin. And of course, there's always surgery for the really stubborn cases.
Okay, so lots of options for hemorrhoids. What about those pesky anal fissures?
For fissures, we need to relax that anal sphincter. That's the muscle that controls the opening. Warm baths, fiber, stool softeners, those all help to reduce tension.
So it's about easing the pressure to let it heal.
Exactly. Topical anesthetics can numb the pain, and nitrates can help relax that muscle even further. Sometimes they even use Botox injections to temporarily paralyze the sphincter.
Botox, like the wrinkle treatment. Whoa, multi-purpose medicine.
It is, and if all else fails, there's a surgical option to release the tension in the sphincter. But that's definitely a last resort.
Okay, so we've covered the common stuff. What about those more serious causes of bleeding? Diverticular disease, for example. We talked about it being a silent culprit earlier.
Yes. And treatment for diverticular bleeding often depends on how severe it is. Sometimes it resolves on its own, but if it's heavy or there are signs of infection, you'll need to head to the hospital.
Okay, so what happens then?
They might give you IV fluids, maybe a blood transfusion if it's needed, and antibiotics if there's an infection. In some cases, they can even do a minimally invasive procedure to block the blood flow to the bleeding pouch.
Wow. Modern medicine is pretty amazing. But I know there's still kind of the elephant in the room, colorectal cancer. Everyone's thinking it, so let's talk about it.
Absolutely. While anal bleeding is usually caused by something less serious, ruling out colorectal cancer is super important, especially if you have other risk factors.
Okay, so aside from the bleeding itself, what are the big red flags that should send someone running to the doctor?
Changes in bowel habits are key. Things like persistent diarrhea or constipation, a feeling like you haven't fully emptied your bowels, or even just a narrowing of your stool.
And I remember you mentioned unexplained weight loss and fatigue earlier. Those are warning signs too, right?
Absolutely. And any abdominal pain or cramping that just won't go away, that could be a sign too.
All right, so those are the red flags. What happens if someone goes to the doctor with those symptoms? What's the next step?
The doctor will probably recommend a colonoscopy to get a good look at your colon and check for any abnormalities.
And if they find something, what are the treatment options for colorectal cancer?
It really depends on the stage and location of the cancer, but it typically involves surgery, chemotherapy, or radiation therapy.
Okay, that's heavy stuff. But early detection seems like it makes a huge difference.
Absolutely. Regular screenings, especially after age 50, are so important.
All right, we've covered a lot: hemorrhoids, fissures, diverticular disease, even colorectal cancer.
Yeah.
But there's still one more major cause of anal bleeding that we need to discuss: inflammatory bowel disease. Let's dig into that next.
All right, so welcome back to our deep dive on anal bleeding, and let's explore those inflammatory bowel diseases in a bit more detail.
Okay, IBD, it's more than just a tummy ache, right? This is where things get a little more complex.
Right. IBD isn't just one thing. It's actually a group of disorders that cause ongoing inflammation in your digestive tract. And the two we hear about most often are Crohn's disease and ulcerative colitis.
So two different conditions, but both under that same IBD umbrella. What sets them apart?
It's all about location, location, location. Ulcerative colitis only affects the inner lining of the colon and rectum, while Crohn's can impact any part of the digestive tract, from your mouth to, well, you know. And Crohn's often goes deeper, digs deeper into the intestinal wall.
So ulcerative colitis is more surface level, and Crohn's is like the deep sea diver of inflammation.
That's a great way to put it. And those differences really show up in the symptoms as well.
Okay, symptom decoder rings on. What are we looking at?
With ulcerative colitis, the hallmark is bloody diarrhea. And we're not just talking an upset stomach, we're talking urgent trips to the bathroom, cramping, and even weight loss.
Not fun. And Crohn's, what's that experience like?
Crohn's symptoms, they really depend on where the inflammation is happening and how severe it is. Abdominal pain is pretty common, but there can also be diarrhea, rectal bleeding, weight loss, and that feeling of just being totally wiped out.
Okay. So both conditions can cause bleeding, but the experience can be pretty different depending on what type of IBD it is. Makes sense. But how do doctors even tell the difference? It sounds like the symptoms can overlap.
It's a bit like detective work. Doctors use a combination of tools. Blood tests can check for inflammation and anemia. Stool tests rule out infections, and imaging studies like CT scans or MRIs, they can give a visual roadmap of your insides.
So it's not just a quick peek in the exam room.
Not quite. The gold standard for diagnosing and monitoring IBD is a colonoscopy. That's how doctors can get a close-up look at the lining of the colon and rectum, take biopsies if needed, and really see how much inflammation is going on.
Okay, colonoscopy, got it. And once a diagnosis is made, what's next? What are the treatment options for IBD?
Well, the goal is threefold: reduce inflammation, manage those symptoms, and then prevent any complications. And medications are the main players here.
So like putting out the fire and keeping things calm, what kind of medications are we talking about?
Oh, there's a whole arsenal. Anti-inflammatories like mesalamine, those are often the first line of defense. Immunosuppressants can help to cool down the immune system's overreaction. And then there are biologics. These are the high-tech weapons that target very specific proteins involved in that whole inflammatory process.
Wow, from basic fire extinguishers to targeted missile strikes. It's amazing how medicine is always evolving. But are medications always enough? Is surgery ever needed for IBD?
Sometimes, yeah, unfortunately. If meds aren't cutting it, or if there are complications like a bowel obstruction or what's called a fistula, surgery might be needed to remove the damaged part of the digestive tract.
Okay, that's pretty intense. But
Yeah.
good to know there are options. We've covered a lot about IBD, the different types, the symptoms, diagnosis, treatments. But I'm kind of thinking back to what we talked about earlier, those less serious causes of bleeding, like hemorrhoids and fissures. Let's revisit those and dive a bit deeper into how they're actually diagnosed and treated.
Great idea. People often feel really embarrassed about these conditions, but just knowing what to expect can make the whole thing less intimidating.
Exactly. Let's break the stigma and get informed.
Yeah.
So back to hemorrhoids. What happens when you actually go to the doctor for those? Is it, like, awkward?
Honestly, it's less awkward than people imagine. Doctors deal with this all the time. Typically, they'll do a physical exam, including a digital rectal exam to check for hemorrhoids. They might also use a tool called an anoscope to get a better look.
An anoscope. Sounds a little scary. What is that exactly?
It's basically a small lighted tube that allows the doctor to see inside the anus and rectum. Really not as bad as it sounds.
Okay, good to know. So after the exam, is that when they recommend those home remedies we talked about? Creams, sitz baths, fiber?
Usually, yeah. For mild cases, those are often the first line of treatment. But if those don't help, or if the hemorrhoids are more severe, there are other options.
Like those rubber band ligations and sclerotherapy injections we were talking about.
Exactly. And sometimes surgery is needed, but that's usually the last resort.
Okay, so lots of options for hemorrhoids. What about anal fissures? How are those diagnosed?
The diagnosis is usually pretty straightforward. The doctor will likely just do a visual exam, gently spreading the buttocks to see the area. They might use an anoscope if they need a closer look, but often it's just a visual thing.
And what about treatment? Is it similar to hemorrhoids?
There are some similarities. Again, the initial focus is on easing symptoms and promoting healing. So warm sitz baths, fiber, and stool softeners are all really key.
Makes sense. But I imagine the pain with fissures can be pretty intense. What about medication? Is there anything to help with that?
Absolutely. Topical anesthetics can numb the pain, and there are medications that can help relax the anal sphincter, reduce those painful spasms. And believe it or not, sometimes Botox injections are used to temporarily paralyze that sphincter muscle, allows the fissure to heal.
Botox?
Seriously.
That's fascinating. It seems like Botox is being used for everything these days.
It really is, and it's quite effective for fissures. But if those treatments don't work, there's a surgical procedure that can be done to release the tension in that anal sphincter muscle. But again, that's usually a last resort.
Okay, so a lot of options for fissures as well. It's reassuring to know that there are treatments available, whether it's a minor annoyance or something more serious. But speaking of serious, we talked about diverticular disease earlier, and I remember you saying that the bleeding can be sudden and painless. That sounds pretty alarming. How do doctors even diagnose diverticular bleeding, especially if there's no pain?
That's where a colonoscopy becomes really important. It allows the doctor to visualize the inside of the colon, identify any diverticula, and see if there are signs of bleeding or inflammation.
So it's a bit of a mystery until they get in there and take a look.
In a way, yes. And once they've identified diverticular bleeding, the treatment really depends on how severe it is.
What do you mean?
Well, in many cases, diverticular bleeding actually stops on its own without any specific treatment.
Really? That's good to know.
It is. However, if the bleeding is heavy or it keeps coming back, or if there are signs of an infection, hospitalization might be necessary.
Okay, that makes sense. What kind of treatment would they receive in the hospital?
It could involve intravenous fluids to replace lost blood volume. And if the bleeding is very severe, they might need a blood transfusion. If there's an infection, they'll get antibiotics. And in some cases, they might perform a procedure called a colonoscopic embolization.
Embolization? That sounds intense. What is that exactly?
It's a minimally invasive procedure where they insert a catheter into a blood vessel and inject a substance that blocks the blood flow to the bleeding diverticulum.
So they're basically cutting off the blood supply to the area that's bleeding. That's incredible.
It is. Modern medicine is pretty amazing, isn't it? And thankfully, most cases of diverticular bleeding can be managed effectively with these techniques. But, I know there's one more cause of anal bleeding that we need to address, and it's the one that often causes the most anxiety: colorectal cancer. It's important to remember that while bleeding can be a symptom, there are often other signs that accompany it.
Right. We talked about those red flags earlier, changes in bowel habits, unexplained weight loss, fatigue, abdominal pain. But let's get even more specific. What exactly are we talking about when we say changes in bowel habits? What should people be looking out for?
Think about anything out of the ordinary for you. Persistent diarrhea or constipation that just won't let up. A feeling that you haven't completely emptied your bowels even after going to the bathroom. Or noticing that your stool has become unusually narrow. Those are all signs that something might be off.
Okay, so pay attention to those subtle changes. And if someone is experiencing those red flags along with bleeding, what should they do?
The first step is to talk to their doctor. They'll likely recommend a colonoscopy to examine the colon and rule out any serious problems. Early detection is key when it comes to colorectal cancer.
Absolutely. We've covered so much ground today, from the common and often embarrassing causes of anal bleeding to the more serious conditions that require prompt medical attention. It's been a fascinating deep dive. But I think it's time to wrap things up and leave our listeners with some final thoughts and takeaways. What are the most important things you want people to remember from our conversation today?
So, we've talked about a lot of different causes of anal bleeding, but I think one of the most important takeaways is no matter the cause, ignoring it isn't the answer.
It's kind of like ignoring that check engine light in your car,
Yeah.
right? It might be nothing.
Yeah.
Or it could be something that needs attention.
Exactly.
Right. It's
Yeah.
our body's way of saying, hey, something's up down here. Pay attention.
Yeah.
So let's recap what we've learned, starting with those kind of common culprits: hemorrhoids and fissures.
Hemorrhoids, those swollen veins, often signal their presence with itching, discomfort, and bright red blood, especially when you're, going to the bathroom.
And remember, treatment often focuses on just making things more comfortable, right? Creams, those warm baths, fiber, all about easing that pressure and irritation.
Exactly. And if those simple measures don't do the trick, there are procedures like rubber band ligation, where they basically, cut off the blood supply to the hemorrhoid, causing it to shrink and fall off.
Yeah, it's amazing what they can do these days. And for fissures, those tiny tears that cause that sharp pain, relaxing the anal sphincter muscle is key.
Yep. Think warm baths, fiber, stool softeners, anything to reduce tension and promote healing. And we talk about how sometimes they even use Botox injections to temporarily paralyze the sphincter, give the fissure a chance to heal properly.
Botox for a fissure. Who knew? Really shows how interconnected different parts of our bodies are and how treatments can sometimes come from unexpected places.
It really does. And remember, even though these conditions are really common and usually not serious, it's still important to see a doctor for a proper diagnosis and treatment.
Right. Self-diagnosing, never a good idea. Now, moving on to those more serious causes of bleeding, we discussed diverticular disease, which is often kind of a silent culprit.
It's those little pouches in the colon that can bleed, often without any pain, which is why a colonoscopy is so important for diagnosis.
And the good news is that in many cases, diverticular bleeding stops on its own.
That's right. But if it's severe or there are signs of infection, hospital treatment might be necessary, which could include IV fluids, blood transfusions, or even a procedure to block blood flow to the bleeding area.
Okay, so even for the more serious stuff, there are effective treatments available. But of course, we can't forget about colorectal cancer, which is a major concern for many people.
While anal bleeding is more likely to be caused by something less serious, ruling out colorectal cancer is crucial, especially if there are other red flags.
And those red flags include changes in bowel habits, unexplained weight loss, fatigue, and persistent abdominal pain.
Exactly. So if you're experiencing any of those, along with bleeding, it's time to talk to your doctor. Early detection is key when it comes to colorectal cancer.
Right. Regular screenings, especially after age 50, can make a huge difference.
Absolutely. And what's fascinating is that while we've talked about all these different causes and treatments, it really boils down to one key message: listen to your body.
That's such a powerful point. Our bodies are constantly sending us signals, and it's up to us to pay attention.
Exactly. Anal bleeding, whether it's a minor annoyance or a more serious concern, is a signal that shouldn't be ignored.
I think that's the perfect note to end on. Knowledge is power. And now, hopefully, you're equipped with a better understanding of anal bleeding, the causes, the treatments, and most importantly, the importance of seeking medical advice when needed.
Well said. Take care of yourselves. And remember, there's no shame in talking about these things. Your health is worth it.